Got it.
I'm Dr. Diva. This is Jennifer. So what brings you in, my dear?
Lots of collagen.
You have makeup on.
Yeah.
Did you come from work?
No. So as you see right here, this happens a lot, and I do a lot of telehealth.
Okay.
Yeah, and it's very noticeable when I'm on camera.
Okay.
But it was a little worse in the stages of menopause. So.
Okay. Okay. So if you can point out to one area, just that one area that's bothering you the most.
Well, I'm pretty sure it's a lack of balance as well.
Okay, so you feel like it's not balanced.
Right.
Okay.
Because it's a loss of collagen over here, along with some acne and some other things going on. But this right here, it was actually worse. But I've been on some hormone replacement therapy, and
how is that helping?
A little bit better.
A little bit better? Yeah. When you say loss of collagen, are you only talking about lower face, or you have any issues here?
Just right here. Just right there.
Okay. Is it okay if I remove a little bit of makeup? Okay. Then maybe we can remove the glasses.
Sure.
Do you need them to see?
Mm-hmm.
Okay.
I have to wear my contact. I have it. So along with hyperpigmentation, acne.
Okay. I'm going to start around the eyes. You have discoloration around the eyes too.
Yeah, I was going to ask about a peel later.
Have you ever had a peel?
Mm-hmm. I've had several.
How does that work for you?
I just moved from DC. The ones I was getting there
really
wasn't that great, but I used to go somewhere here before I moved up north. I can't think of the name of it. It was in Boys Town. Leah Chavez. That's where it was.
The place?
Mm-hmm.
What kind of chemical peels have you done? It's a spa? Mm-hmm. It's not a medical place?
No, I don't think they have a.
So I mean, it's more chemical. Yeah. It should be more DC, superficial.
Going to a.
That means they're probably more superficial peels, not deeper.
Right, but in DC it was a doctor. She did the. She did some kind of filler here, and she did a peel. I think with that.
Okay. This side isn't as bad. It's that side.
Yeah.
Meaning like this discoloration.
Side. No, everything on the left side. My shoulder was messed up. Over here, a lot of hair. This is
the hormonal from the menopause.
I don't have any over here, but over here I have like 3. Yeah.
Very low. Have any scarring?
Mm-hmm.
Anything happen here?
No. Other than hyperpigmentation.
Any scarring from the chemical peels?
No.
Looks like scarring to me. You agree? Look like scarring. Never felt like any burning sensation when you was doing the chemical peels?
No, I did the other thing with the oxygen. Can't think of it. I didn't like that one either.
But did you ever have like any skin discoloration, or you felt like your face was like inflamed? No? If it's not, then that's fine. I just want to make sure I understand what's going on with your skin. You have hyperpigmentation. It's even darker around your eyelids. I'm sorry, I'll get that. Do you feel comfortable walking out the door with without makeup?
No.
Are you ready to start walking out the door without makeup? You ready to do that? Let's do that, okay? Only because it's white as well. Have you ever had microneedling?
No.
No? Okay. I'm going to take a photo. You don't have anything on your neck. Okay, perfect. Usually have my little trash can over there. It's okay. You said you had filler before because you booked the filler appointment. It's like, I just got this collagen over here, so fill it up.
No, not on that one. Okay. It was always over there.
Okay. Do me a favor and look here. Here. It's okay. Jennifer, can you go that way to the left? Thank you. Okay, I'm going to let those load.
Yes, I want to do a peel consultation later.
What's going to take time? The peel doesn't take time, but the process may take time. That makes sense. So there's a few things that's going on here that I'm thinking. So this is your photo, right?
Mm-hmm.
It looks as if you had some type of scarring, some type of trauma that happened right here, okay? And even in your lower chin in here. So I know you say you feel like you have collagen loss. This looks like scar tissue to me, okay? Not sure why or how it happened. Maybe you feel like I don't remember how this happened, but that's exactly what it appears to me. The good thing about it, we can improve it. So what I recommend, I know you said something about a chemical peel. You need a combination of things. You need a chemical peel, but you need microneedling with radiofrequency first. We need to break this up, break up this scar tissue. And then we can round robin it with the chemical peel, something called a medium grade chemical peel. It goes deeper into the dermal layer, which I'll show you what that looks like in a second. Filler is great because you do have volume loss underneath the eye area. I'm not sure if you have mascara on or eyeliner, so it might make it a little darker than what I'm seeing on the photo, but you also have volume loss here. Okay, so that's easy. And then you're starting to get this hooding around the eye area. Okay, so my goal for you, which I believe will be a shared goal, is to make all this one color and texture too.
Right.
Okay, so when it comes to texture, I want this to be smooth like this. This is a little texturized, but if we can do anything, I want you not to have this no more. Okay. Now filler is easy fix. We can put a little filler in upper face. You have anterior and lateral loss, not too much laterally, mostly underneath the tear trough area. This smile line looks very, very subtle and soft, but you do have a little volume loss. You do have some congestion here, I can tell, but it's hard to tell breaking in this scar tissue here. The scar tissue actually comes down to this nasolabial fold on the left. So that's probably why you feel like it has collagen loss. Yes, we can also put filler here, which is okay, but I will put more filler here and kind of leave this alone, or put a little pop of filler there, maybe like an Eloquat, massage it in, leave it. But mostly put filler here. It's going to lift that up, okay? So it have some symmetry here, some balance, as you would call it, okay? But my ultimate goal is to make sure that you feel confident enough that you don't have to wear any makeup if you want to walk outside. Just put your glasses on, sunshade, some lipstick, and call it a day, like Tyra Banks say. That's my go-to when I don't have nothing on, right? But I kind of want to go over a little bit on kind of what's going on in the skin. So here we have a picture of our skin anatomy. We have the epidermal layer, then we have the dermis. The dermis, we have elastic fibers, we have collagen, and we also have hyaluronic acid, which is in aesthetic medicine, we call it derma filler. And then we have the hypodermis in the muscle, and then underneath we have the bone. What I'm seeing in your skin quality, this is already compromised, but you have very supple support, which is good. So you have a nice amount of fat pad here. Like, it's still pretty supple. Somewhere, somehow, there is some type of scarring. So usually when we have trauma to the skin, this is already compromised and it atrophies. It kind of gets tangled up. It gets thicker. So even if you don't have a lot of elastin and collagen support here, it's thick, but it's less. That makes sense. It's not as dense like this, like as many, but the ones you do have is thicker to penetrate and break up. We want to do that with a technology called radiofrequency, and the reason we want to do that so we can reconnect it, but also thin it out and make it supple, make it softer, so we can bounce this back and make sure that the grooves are nice and smooth. Okay. And when you have a chemical peel, the chemical peel, for the most part, something we call superficial chemical peels, medium grade chemical peels, and deep chemical peels. You've had chemical peels. If you went to like a spa, most likely they had like a superficial chemical peels, because you have to have like a medical director to do anything deeper than a superficial chemical peel. So like a gesture peel.
Maybe 2023 last time I saw that.
So it's like the surface, right? So we want to get to that dermal layer here, or even deeper, to kind of lift that up and have the skin remodel itself. So we have a normal cell cycle, 21 to 28 days. And when you're doing a chemical peel, you want to have a lot of support too, like a lot of peptides, a sunscreen, stem cells, things of that nature that's going to support the skin, and a lot of moisture, because the chemical peel will dry your skin out for sure. Okay. So just to address one concern at a time, do you have any questions for me? Not right now. Have anybody ever said anything about microneedling radio frequency to you before?
No, I was seeing the dermatologist who did the the peel the last time. She did something else. I just can't think of it.
You don't need nothing else but microneedling with radiofrequency. You don't need a laser. You don't need
That's
any
what it
of
was. It
that.
was some kind of laser.
You don't need a laser right now, unless it's a CO2 laser. That may be like a cool peel laser.
Mm-hmm.
And a lot of times you can have laser, but you need multiple treatments on a very low settings because you have a Fitzpatrick, like a 3 to 4 skin type. Mm-hmm. So you're prone to something called hyperpigmentation and hypopigmentation. So it can make you lighter, like patchy, or it can make you darker.
Okay.
So I just don't recommend it, to be honest.
Oh.
I just don't recommend it. One thing about radiofrequency is good for all skin types, no matter what.
Okay.
Okay. As long as we pulling the heat out the face, you're safe to go.
Okay.
As many passes. Okay. I'm thinking about one person, but I can't think of my brain right now. I want to show you one person who has some scarring. I think her name is Brittany. I don't know. I got it right. Irene knows more than me when it comes to people's name, even though after the second or third visit, I got your name down pat. But sometimes I see so many people a week, I'd be like, Tamika. Can you show me a photo? But it's okay. See, this she got in a car accident and she has this scarring here in her lip. And we're thinning it out. So we're making it nice, smoother, and lighter.
Okay.
So all we have to do is go over 2 more times and it's going to be like this.
Mm-hmm.
Okay. So this is only one treatment. Okay. So we want to 3 to 4 for sure. 3 to 4, but I will rather round robin it with a chemical peel. Mm-hmm. So you do that, then you do a chemical peel. Then you do it again, then you do the chemical peel. And the only reason we're not using it for pigmentation issues, even though pigment will be lifted, we're doing it to remodel the skin at the cellular level, the dermal layer. So that nice, beautiful, fresh layer comes to surface. And then also making sure you have really strong products for the peptides and the moisturizers and the stem cells and brighteners and things of that nature. In protection, at least SPF. You've been a fixed factor 3 to 4, maybe 30 to 40%, even 50 to be protective if we definitely going into that dermal layer, creating those micro injuries, and always cooling off the skin. Because one mechanism of action of melanocytes, melanin is defensive. We don't want you to get darker. So we have to be cautious and do it in a sequence. I could say 2 to 3 months, you'll have beautiful skin. And you don't have to continue to wear makeup.
Okay.
Makeup optional, okay? That's the goal. Always the goal. Okay. Okay, just for the filler, if you only want to focus on the filler, you can definitely do a little filler here. That is easy. That'll give you balance.
I heard that it was better to do it in sheets, but the dermatologist I saw did it.
One thing about, I hate to say it, when it comes to being in the professional service, we have other people counteracting or counter-judging what other people do. Think about on social media, you see people reacting to other professionals. Right. That's why second and third opinions matter. Like if I had something that's going on and I'm not confident in the physician or whoever, nurse practitioner, give me the results, I'm gonna get a second opinion. Then they're gonna give me something completely different. So sometimes we get confused as regular civilians, and if we don't have medical knowledge, we like, I don't know who to listen to because I'm going to this person, they seem to know what they're talking about. They went to school, but a lot of times, I hate to say it, especially in aesthetic medicine and in dermatology and in cosmetic, people are just selling what they got, not what you need. If I don't have it, meaning I'll tell you, I can't treat you, but this is why I recommend. So even if me sending you to someone else and you can find it, I can even help you find it, they will give you the results you're looking for. Some people just sell what they got. Like, this is what we got in house. This is what you need. That makes sense? Like some people have surgeries that they don't even need. Right. Because they have to meet a quota for the month, or we have to meet our revenue goals because the business still have to eat. Unfortunately, that is the truth. Okay, so likelihood, even Jennifer, we both will agree that filler here, never the best place. Always upper face first. Okay, so I'm going to show you something. And if we do, it'll be very subtle and more of a biostimulator, not a HA. So we have HAs, which is hyaluronic acid that we already have naturally in the body, and that's the Juvederm, the Restylane, the filler that we can dissolve. Then we have the non-HAs, that's the biostimulators, the ones that we cannot dissolve that stimulate your natural collagen. That's the Radius, that's the Sculptra. Those type of things we'll put kind of here, just a tad bit. And then contour the face here. So it grows, and even if you lose weight, it's still there. It's still getting better over time. When you put HA, especially in these deep areas, it's good because I love Voluma. It's one of my favorite fillers, especially for the cheek area. But I also go upper face a little bit into the eye area so we won't have that sagging as well. But kind of putting it here, more of a softer filler if we was to do an HA. So filler placement technique is always important. So just based on your concern of having this asymmetry, I will focus more upper face. You see, even if I pull that, how soft that is, I don't have to feel here, because over time filler do migrate. It can. Over time it will absorb in your body, but not all of it. People say, you know, filler is going to be 100% gone. That's what they tell us. Sometimes it may be 10% there, 15% there. No one truly knows unless they do like an ultrasound or an MRI. But to be safe, I'd rather just fix upper face, both sides. You won't even have that issue. So now it's balanced. And if we need to drop a little sprinkle there to kind of massage in to fill the gap, then we do that, but not put a lot there, because then over time it falls down. Then you look like a chipmunk.
Okay.
And you can't say you came here. Okay? Because we don't do that here.
Okay.
Okay. So that's what I recommend. Just a little pop of filler. That's it. Maybe a little sprinkle on that. But overall, start treating the skin. Are you on any skincare products like tretinoins or anything?
Muesli.
Muesli, what's the strength? Do you know?
I think it is 2%.
Tretinoin usually goes 0.1.
No, it's the spot cream.
So you're doing it for more hydroquinone?
Yes.
So it should be a combination therapy with Muesli.
It's an anti-aging and a spot.
Do they have any vitamin A derivatives?
No.
Let me see. Hydroquinone, 6-ascorbic acid. No, you need something that's going to help turn over your cellular level. Hyaluronic acid, no, ascorbic acid. That's for basically brightening. That's for moisture. No. So you don't have any vitamin A derivatives in this product, which you should have, especially since you have this skin condition. So if you want to take it slow, I'm with you. You're in the driver's seat, I'm in the passenger seat, just telling you to go left or right, okay? So filler is fine because we can get some balancing, but definitely start on a tretinoin for sure. You can use it with this since it doesn't already have it in there. So start slow, maybe a 0.25 or 0.5.
They did give me one and I didn't take it well.
Meaning that you got red and raw?
Not red and raw. Everything I have these dry patches.
So that means you combine it with a moisturizer. And it only can be used at night because it thins the skin out.
Okay.
So maybe a couple times a week, Mondays and Thursdays. That's it. That will start alleviating some of the pigment and some of that scarring that we see on the surface of the skin, okay? Until we can get to the needling part or something you want to do. Something I highly recommend if you want to make it
frequency. Yeah.
Want to make it smooth, let's do that, okay? So just for the filler, just to kind of give you a pop, looking at more, we could do one or two things. We can do a biostimulator, which will be $900, or we could do 2 HAs, which would be $1,600. Both is good. Both will give you a longevity. I'll say HA, only because we can also take care of the eyes a little bit as well. When it comes to the series of the RF 2025, at least for 3, if you want to do that, I'll probably throw one in for free just to give you the results you want. And then you can stay on the medication that you're already on. The only thing I will add is a tretinoin, which is a vitamin A derivative. So you can have that quick cellular turnover, and add on peptides. So you can have that moisture, something very, very rich and hydrating of the skin that's going to give you the best outcome. And you're going to be like, you'll be my friend forever, okay? Okay, so the choice is yours. What would you like to do?
The one that you said you can do under here as well.
Okay, so we're going to do HA today. Okay, so let's do some eye filler. And then also, I want to start showing the vitamin A derivative. So we have some here too. So, and also a peptide. So just add that in. So I'm not sure what all products you have at home, so always thin to thick. So for an example, if you have a cleanser, so do your cleanser, you have a cleanser? You have a toner?
No.
You need a toner, a pH balancing toner, okay? So any products you put in after, it get absorbed a lot better. So then any serums that you use. You have serums? So if it's very thin, use that, and then start using the thicker products. The consistency, what I mean thin to thick. And then you seal it with sunscreen. You ain't got to seal it with sunscreen at night. But you can seal it with a moisturizer at night, especially if you're using a tretinoin or something like that. So, and then also sometimes you can sandwich it. So let's say you do the cleanser, the toner, a vitamin C serum, you do a peptide, mix it with a little bit of the tretinoin, just put it all over. That makes sense?
Yeah, I like it like that.
Yeah. So when you wake up, your skin isn't so dry.
Yes.
Yeah. And you only do it at night.
Yeah. Okay.
It causes patches, the tretinoin. Yeah, we won't need that.
Okay.
Okay. All right. All right. Let's do it.